I did accept.
So the scenario, who will be the patient for Fatah Rahman? Hassan?
هو انا بناء بروستاتيك
Okay.
هايبربليزيا.
Yeah.
انا
Can
ممكن اكون
okay,
بيشنت لو
perfect.
عندي تقديم ممكن اكون بيشنت.
Okay, perfect.
خلاص تمام. طيب.
So the scenario is a 72 years old man present with urinary retention. You are surgically HO. Please take focus history from Mr. Jack. Let me put the 6 minute.
We make you the patient just to practice. Me and Muhammad can be the patient. We already here, but we think if you are the patient, that's also opportunity to learn.
Yes.
Yes,
exactly. Good idea.
Okay.
Yes.
Okay, 6 minutes started. Start.
Good evening. I'm Dr. Fatah Rahman, a surgical doctor working here. May I confirm your name and age, please?
Good evening, doctor. I'm Mr. Jack. I'm 72 years old.
Nice to meet you, Mr. Jack.
Me
I
too.
would like to ask you a few questions regarding your condition. Are you okay with that?
Yes, go ahead, doctor.
Mr. Jack, how I can help you today?
Yeah, doctor, I can't pass urine.
Can you tell me more about this?
Yeah, it started about 3 months ago when I started by difficulty in passing urine and my urine not coming out as previous, as the past.
Sorry to hear that.
Yeah.
Does it start suddenly or gradually?
No, as I mentioned before, it is not started gradually, but since early morning, I wake up and I can't pass my urine.
Okay. Is this worsening or improving now?
No, it looks worsening because as the past, he says difficult to initiate urination, but now I can't totally pass urine.
Sorry, Mr. Jack, to hear that. Does anything increase or worsening it?
No, nothing. I don't know.
Is it improved by anything or no?
No.
Okay. Mr. Jack, do you feel that you cannot hold your urine?
Yes. Sometimes I dribbling in my pants before before reach the toilet.
Sorry to hear that, Mr. Jack. Mr. Jack, do you face any problem when you are starting urination?
Yeah, sometimes.
Sorry. Mr. Jack, you said that you have dribbling after urination.
Yeah, there's dribbling. Even before urination, I can't hold my urine till to reach the toilet. When I went to the urine, I found my pants is wet.
Is the frequency of visiting the low is increasing now?
Yes, especially at night, doctor.
You mean many times at night?
All the day, but many times at night I started to wake at night many times to go to pass urine.
Understanding it is very difficult to you. Mr. Jack, do you have any back pain?
No, I don't have back pain.
Do you have any fever or chills recently?
No.
Mr. Jack, do you have blood is in the loo?
No.
No. Mr. Jack, do you have any trauma at your groin area?
No.
Mr. Jack, are you diagnosed with any medical illness?
Yes, I have hypertension, but my blood pressure is high, but I'm doing okay with my pills.
What medication you are taking?
I'm taking atenolol, 50 milligram.
Do you have any allergy about any medications or anything?
No.
Mr. Jack, do you notice any weight loss recently?
Not actually. I'm well.
And you mentioned there is no blood and no back pain.
No.
Mr. Jack, do you notice any weakness or numbness in your leg?
No, it is okay. Even I'm practicing my exercise normal, but today I can't.
Yes. Mr. Jack, do you have any problem with erection?
No, no, I'm good.
Okay. Mr. Jack, anyone in the family have a similar symptoms?
Yes, I think my uncle diagnosed with advanced prostate, but at the end he died many years ago.
Very sorry to hear that, Jack. Mr. Jack, do you mind to ask personal questions?
Yes, of course.
What's your job, Mr. Jack?
I'm teacher, but I'm retired now.
Okay. Who is living with you at home?
My wife.
Mr. Jack, do you drink or smoke cigarettes?
I'm not a smoker, but I drink occasionally at the weekend only.
Okay, Mr. Jack, do you know what's the idea about your symptoms?
Yeah, I think it is something serious.
No worries. We will figure it out. We are doing our best to figure it out.
Yeah.
What's the most concern of your condition?
Yeah, I want to feel calm, because this is very irritating for me. I can't pass my urine.
We'll figure it out. Mr. Jack, do you have a headache?
No.
Do you have a chest pain or cough?
No.
Do you have tummy pain?
Just apart from this morning, lower tummy pain. Yeah.
Yes, understand. Do you have facing any problem with bowel work?
No, it's good.
Time up. Could you please present your case?
I took a clinical history from this gentleman, Mr. Jack, who present with urine retention for the last couple of months, which start gradually and become worsening, associated with nocturnal urination and dribbling and urgency. He have no symptoms suggestive of infection of malignancy. So my main diagnosis is benign prostatic hyperplasia.
What are your other differential diagnoses, doctor?
I will consider prostatic cancer, bladder cancer, urinary tract infection. Also, I will consider neurological causes like spinal cord compression and neurogenic bladder.
Okay. And how to approach this patient?
First, I will start with clinical examination of the abdomen and palpating the bladder, of course, including digital rectal examination to assess the prostate consistency. Then I will do urine analysis. Of course, I will start prostatic specific antigen and do routine blood work for full blood count to look for leukocytosis indicating infection. I will do inflammatory markers, renal function test, and liver function test. Also, I will order transrectal ultrasound. I will do cystoscopy to visualize the prostate.
Okay.
We do post-voiding residual volume also.
You mentioned you will check the prostate-specific antigen. Can you mention the causes of increased prostate-specific antigen?
Yes, prostatic cancer, overgrowth like benign prostatic hyperplasia, and recurrent urinary tract infection, and instrumentation, catheter or cystoscopy, and sexual activities.
Yeah, okay. And how would you treat this patient?
I will discuss the patient in multidisciplinary meeting. Then I will offer medical treatment in the form of alpha blocker to relax the muscle around the bladder neck. Also, I will like toxazosine, and also I will order alpha reductase inhibitors like finasteride to decrease the size of the prostate. In a surgical, I will do QRP. Sorry.
Okay, continue your answer, please.
Yes, I will do total transurethral resection of the prostate.
Which alpha blockers lower blood pressure?
I'm fine, thank you.
Thank you.
No, continue, please. Which alpha blocker lower blood pressure?
Doxazicin and tamsulosin.
Would phenylphrine or salbutamol affect management?
Phenylphrine as an alpha blocker counteract the action of the alpha blockers.
Time up, but continue.
Salbutamol is beta blockers. There is no effect on the alpha blockers treatment.
Okay, I think this is the last question in this session. Ali, can I start with Fath
Yes, of
Rahman?
course. Yes, of course, yeah, Muhammad. I just want to, Ala is here, welcome. So, yes, from now on, you're going to start the first comment and then I'm going to be the second afterward.
Okay, Fath Rahman,
Yes.
19 out of 20.
Yes, that's a very good presentation, yeah.
Yeah, very nice presentation. You know why I omit these marks? The only thing, you double the question when you ask Al-Fatih, did you experience any chest pain or cough?
Yes.
So I took half of the mark in this, and the other mark you didn't allow anyone to master the session. You didn't allow one to master the session. You start by asking the patient opening question, tell me more about it, which will increase the mark of professionalism. You showed empathy, which increase mark of communication skills. You start your first differential diagnosis, benign prostatic hyperplasia, which will increase the mark of professionalism. You said Mr. Jack a couple of times, also marks of communications. Yeah, you just skip weight loss and you return to ask about it. I'm so glad that you remember it. You ask about the personal questions. Can I ask you, do you mind if I ask you personal question? Also marks of professionalism. You ask about the eyes, which also increase the mark both of professionalism and communications. And regarding the discussion, you start by the clinical examination, also marks of professionalism. Very nice presentation, Fath Rahman. I have no point to add. Ali?
But Rahman, very good. You can look. I wish if you there's a huge jump. You stress the bit on the middle of the conversation, but you calm down, you stay silent, and then you continue. It's very good. It's obvious there's a huge improvement. There's just small bars that I need you to improve.
Okay.
But overall, that's a pass for the session, definitely. Instead of you saying how I can help you.
Voice, please, voice. You are muting.
Oh, so I was talking for 2 minutes. That's a good presentation, huge improvement, thumbs up. There's small point that you just need to correct. And instead of saying how I can help you, you should say how can I help you. You know that from grammatical point of view. Yes.
Okay.
I want you to be very clear. مرات بتاكل الكلام يا الفاتح يا فتح الرحمن. Just say every sentence very clear. Make sure that you say every sentence very clear. Don't talk like that. Just slowly and you said understand. You can say I understand or understood or I see. I see, like what Hassan does. But overall, this will not take any of your mark. That's a very good presentation. That's an ideal presentation. You asked about all the questions, so I have nothing to say. I just want to know if you studied from school, right? You studied from school.
All school, honestly, all school.
All right. What do you think about our mnemonic for the causes of increased BSA?
Yes, good.
Very nice. Very nice.
Very nice.
Like I stayed for an hour just to create a mnemonic that no one should forget. And there's no mnemonic in the world for this process. It's just ours. I should trademark it.
Yes.
The causes of high BSA are in the word prost, B-R-O-S-T. B for prostate cancer, R for recurrent infection, O for overgrowth, which is benign prostatic hyperplasia, S for sexual activity, and T for tool. It's already on the school.
Very nice.
Very nice.
Yeah.
Okay. Any question before we move to the next?
Well, I concern just mentioned by Dr. Muhammad, double infection is the same symptoms, cough and shortness of breath, fever and chills like this. Yeah. And it, alhamdulillah.
Yes. this will not reduce your mark. You just need to be very clear in the way you communicate. That's it.
Okay.
All right.
Thank
Muhammad,
you.
Ali, give me 30 seconds. 30 seconds just.
I can put the timer, no worries. I can carry on. So the next station is unilateral tonsillar swelling. Very common station, especially in Gulf area. Very common station. Who want to take this one?
Okay, I can take it.
All right, Ahmed Al-Soudi.
Yes.
Unilateral tonsillar swelling. And Hassan, can you be the patient for him, please?
Okay.
So you know the station. So it's a unilateral tonsillar swelling. According to our school, we went to the nasopharyngeal carcinoma, squamous cell carcinoma. Okay.
Tonsillar, yes.
Okay.
Yeah. So mention positive all the red flags, weight loss and stuff, snoring and stuff. Okay, fine. Let me, Muhammad, you want to put the timer?
No, could you please put it?
All right, fine. Timer for 6 minutes. Just give me 1 second. Yeah, 6 minutes started.
Hello, I am Dr. Ahmed Al-Sougi, one of surgical doctor. Can I confirm your name and date of your age, please?
I'm Mr. John, 55 years old.
Oh, nice to meet you, Mr. John. How can I help
Nice to
you
meet you,
today?
doctor. Yes, I have this swelling in my tonsils. I don't know what's the problem.
Oh, I am really sorry. I'm really sorry to hear that, Mr. John. Can you tell me more about it?
Yes, it started about 3 weeks ago or 4 weeks ago
Mm-hmm.
when I first noticed it. It's very difficult for me because I cannot do anything. I cannot eat. It's painful.
Mm-hmm.
So I
Irvin.
All right. Okay. Good. So you still have 12 seconds because you have time. Do you want to get to the question of PET CT scan?
No. Sorry.
Time is finished anyway. You can move to the next station. All right. Good. Good, Ahmed. Okay. Let's start from the start. You introduce yourself. You took permission. You remember the basics. We repeated the station because Muhammad logged out. Maybe his internet. So you said, hello, my name is Ahmed. I'm one of the surgical doctor at the start. I'm talking about the one that we canceled. I'm one of the surgical doctor working here. Just this sabba. You have to remember it this way. I'm one of the surgical doctor working here. May I confirm your name and date of birth? You said date of birth and then age. Choose one of them. Hello, my name is Ahmed. I'm one of the surgical doctor working here. May I confirm your name and date of birth? Like this. Don't change your mind between date of birth and age. Okay? Both are right. Okay. You asked firstly about the neoplastic causes, especially the nasopharyngeal squamous cell, and then the infective, but you just forgot to ask about the history travel of history for the glandular fever. But to be honest, you may lose half of mark. It's not like a big deal because you asked about the abdominal pain, you asked about the skin gain, but you just missed part of the differential. So you didn't miss all the differential. If you missed all the differential, that's going to be a problem. But if you missed one question of a big differential that has 5 questions, that's a very minor mistake. Still you have some stopping, which I want you to get rid of. I want you just to answer, okay? Which will come with the practice, but there's a huge improvement. And as I said, this is bus. What you've done here is bus, but we want to make it better and better and better, okay? You asked about eyes. The time was more than sufficient for you. In the discussion, you forgot in your differential non-Hodgkin lymphoma, which is very important.
Yes.
Very, very important. And you said that I will do full ENT examination. That was very good. I asked you new questions. That not in the school just to train you. There's new questions. So monospot is to exclude TB. Monospot is part of the TB. And you forgot the band endoscopy, which like a whole endoscopy. That's also part of your investigation. And PET CT scan is for position emission tomography. Position emission tomography. And if you have this station, probably they will not ask you this question. I just throw them at you just to train you. If there's a new question, you shouldn't say I don't know. What you should say, you should say, can we come to this question later? Don't say ever, because if you answer I don't know, then there's 0 for your mark. You had time at the end. If you said I don't know, I will not say we're gonna come back to the question. I will just give you 0. But if you said, can I come to this question later on? Okay.
Okay.
In your treatment, it's MDT discussion, especially ENT and oncology. Staging investigation, including MRI, CT scan, and liver ultrasound. Surgical, modified radical neck dissection. You forgot radiotherapy.
No, I said.
You said radiotherapy, fine. Okay, that's a very good presentation. I have no other point. I'm not sure if Mohammed joined already.
Yes, I have just one point. I'm really sorry that I lost my internet connection. Ahmed, the only thing that I would like to mention, when you have 40 seconds remaining in your station, you said I would like to jump to the discussion. You didn't wait at least 10 seconds.
Okay.
Yeah, you may need to ask about the systemic review, which may help you asking questions that you may miss in your differential diagnosis.
Yeah, but in this station, I think he asked to have a systemic review.
Yeah.
Did you?
Yes.
Yeah. Okay. Any question?
Okay. Should we move to the next station?
Just
yeah.
One spot is for Epstein-Barr virus, not tuberculosis.
Glandular fever.
Glandular fever.
This fever, yes.
Yes.
So what's your question, Fatih? Fatah Rahman?
You mentioned for
tuberculosis. About TB.
No. Yeah.
Glandular
fever.
Fatah Rahman, what did you say? Say it again.
You said one spot for tuberculosis, but it is for Epstein-Barr virus for glandular fever.
What is it?
Ali, you confused between TB and Epstein-Barr virus. You said monospot test for TB, but it's for glandular fever.
Oh, yes. Sorry. What is the test for TB? Is T-spot. That's T-spot.
Gene expert.
Yeah.
Yes. So monospot for glandular fever and T-spot for TB.
TB, yes.
Yeah. Fine. Yes.
So
they have the same. They have very confusing. Fine. Yes. Okay. Good.
The last station is unilateral tonsillar swelling. And who will take this station?
No, thyroid.
Thyroid?
Yes.
Yeah, thyroid. Who practice Ala or Hassan? Hassan, I think, or Ala. Who will take this station?
It's okay.
Hassan?
Ala.
Okay. Ala, you will take this station, and Hassan, are you working tomorrow?
Yes, tomorrow I'm working also.
Night or day?
It's
night.
fair, guys, right?
Yes.
The last station, I think Hassan took it.
Okay, so just to please Hassan, because you are working tomorrow night, we're gonna make our session around 2 or 3 p.m. Is that okay with you?
All guys.
If it is 5.
Sorry?
It's okay. 5.
5
p.m.
Okay.
After or 5 p.m. is okay.
That's all right. So tomorrow the session will be earlier just for you, Mr. Hassan. You are a king. We're gonna make the session earlier just for you to practice because you're doing night.
Okay.
Okay, fine. Okay. You will be the patient for Ala, and Ala will take this station.
Okay. Ala, you know the station?
Yes.
Yeah, so let me put 6 minutes. No, let me put the timer. 6 minutes started.
Hello, I'm Dr. I'm one of the surgical here. Can I confirm your name and age?
I'm Mr. John. I'm 55 years old.
Nice to meet you, Mr. John.
Nice to meet you, doctor.
I will be your doctor for today, and I will ask you a few questions for better understanding to your condition. Is that okay with you?
Yes, doctor. No problem.
Okay. How can I help you today?
Yes, I can because here I have this lump in my neck.
I'm really sorry to hear that, Mr. John. Can you tell me more about it?
Yes, it just started about 3 months ago, and I think it's come and go, and I don't know what's happened, but it's maybe I'm afraid it's maybe something serious. So I come to here and need to see and check what's happening with me.
Oh, I'm really sorry to hear that, Mr. John. We're gonna work together to figure out. Did it
Okay,
start?
doctor.
Did it start gradually or suddenly?
Yeah, I think it's gradually.
Has it does it come or go or constant?
Yeah, as I said, it's come and go.
Okay. Has it gotten worse, Mr. John?
Yes, it's getting bigger with time.
Oh, really sorry for that, Mr. John. Anything make it bigger or worse?
Yes, I think when I am coughing or when I am talking, it's getting bigger.
Anything make it better or smaller?
Yes, maybe when I am calm or when I am lying down a bit, maybe getting small.
There's any lump anywhere in your body? Any swelling?
No, doctor, I didn't notice.
Is it painful, the swelling itself?
Yes,
Oh,
yes,
really
doctor.
sorry. Oh, I'm really sorry for that, Mr. John.
Thank you, doctor.
There is any difficulty with swallowing?
Yes, doctor, I cannot eat anything now.
There's any pain with swallowing?
Yes, as I said, doctor, this is very painful for me. This very.
Do you feel how is your mood?
Yeah, my mood is good. I don't think there's difference.
Do you feel like you are anxious or there is any sleep deprivation?
No, doctor.
Okay. Do you feel tired through the day, Mr. John?
Yes, most of time I'm tired.
Okay. Do you feel heat intolerance or feet intolerance?
Yes, doctor.
Okay. There's breathlessness.
Yes, doctor.
Okay, I see. There is. Do you feel? Did that partner tell you you are snoring at sleep?
Yes, I think.
Okay, Mr. John. There's any change in your voice?
I didn't notice that.
Okay. How is your appetite and weight? There's any change in them?
Yes, I think I lost about 5 kilo in the last 3 months.
Last 3 months. I'm sorry for that, Mr. John. Do you feel there's any there's any history of traveling recently?
No, doctor.
There's any discharge or abnormality in your swelling, in your lump, in your neck?
No, doctor.
Okay. Do you feel it like it's hot? Do you feel it warm?
What you said?
Do you feel it heat
Sorry,
or
can you
warm?
repeat?
The swelling itself, do you feel it's hot?
No, doctor.
There's have you been unwell recently or having chills or fever?
No, doctor.
Okay. There is have you experienced similar condition before?
No, doctor.
Any medical condition apart from our condition today?
No, doctor.
Okay. Any previous history for surgery?
No, doctor.
Any history for hospitalization?
No.
Are you in regular medication?
No, doctor.
Do you have allergy to any medication?
No, doctor.
Okay. Do you feel I will ask you a personal question. Is that okay with you?
Yes, go ahead, doctor.
What are you doing for a living?
Yeah, I'm working as a car driver.
Okay, I see. Who live with you, Mr. John?
I'm with my daughter, my son.
Okay, thank you for sharing that, Mr. John. Do you smoke or drink alcohol?
No, doctor.
Do you face any difficulty with the climate step?
No, doctor.
Time up. Could you please present your case?
I took history from 35 years old Mr. John. He is complaining of neck swelling. Start gradually for 1 year. Associated with weight loss, 5 kilogram during 1 month, and in the voice and snoring. No history of traveling or infection. He's not on medication, no chronic illnesses, not a smoker or drink alcohol. He feel there is change in his mood and he feeling anxious.
Okay.
My
From what
leading
you okay, continue. Your leading diagnosis is
my leading diagnosis is multiple toxic
toxic
multinodular
multinodular goiter. Yeah. Okay. What other differential diagnosis you will consider?
Simple multinodular goiter and thyroiditis.
Okay. And how to approach this patient?
I will start my management by doing neck examination and full lymph node examination and discuss with the MDT request for a calcitonin level and thyroid function test, TS, T3, T4, thyroid stimulation test, thyroid stimulation function test.
Okay.
I will do neck ultrasound also and radio isotope scan.
Okay. Do you like to measure any hormones?
Yeah, calcitonin level.
Why you need to measure this hormone?
Yeah, because maybe there's an affection or disease to parathyroid gland.
Okay. You need to exclude you mean medullary carcinoma.
Yeah,
Okay. Is the CT scan needed?
in his condition, I will not need it except in case of
Your patient has difficulty swallowing and snoring and difficulty in breathing.
Yeah, sure, I will need it
Why?
because symptom of compression.
Yeah. Okay. And what causes sudden enlargement of the neck lump?
What cause what?
What causes sudden enlargement of a neck lump?
Hemorrhagic cyst or metastatic proliferation.
Okay. Could you tell me how to manage this patient?
I will request for I will discuss in multidisciplinary team
Mm-hmm.
and
Time up, but continue your answer.
okay. Medication, uh, uh, um, anti-thyroid medication and surgery.
Mm-hmm. Mm-hmm. What surgery you will consider?
I will consider total or subtotal thyroidectomy.
You said MDT and antithyroid and surgery. What other thing?
Radioactive iodine.
Yes. And what will you consult before thyroidectomy?
I will consult about the complication for anesthesia and the surgery itself.
Mhm. The last question in this session. Very nice. Ala, Ali, you would like to start?
No, you start.
Okay. Ala, very nice presentation. Let us review it from the beginning to cover all the mistakes. Ala, you start by saying your name, then you skip it. Hello, my name is Ala. Then, hello, I am one of the surgical doctor. You should introduce yourself. Hello, my name is Ala. I am one of the surgical doctor. You analyze the main complaint perfectly. You start your main differential diagnosis with thyroid cancer, but you didn't ask all the questions related to the thyroid cancer consequently. You asked about the swallowing, which is the comparison symptoms. Then you ask about the sign of hyperthyroidism. Yeah, it could be both for toxic multinodular goiter, but it's better to exclude the malignancy first, then other differential diagnosis. You ask couple of time about double question. You ask about the appetite and weight loss. Let me remind you, when you asked Hassan Al-Fatih, I think Hassan, when you asked,
Hassan, yeah.
you asked Hassan about how about your appetite and weight loss, Hassan just answered you about weight loss. He skipped appetite because this is a double question. He didn't remember. Okay. So separate your question. Also, you ask about did you travel recently or have a fever or chills? 3 questions. Maybe fever and chills, we can take it together, but separate your questions better. And
Yeah, so we spent like 6 or 10 hours just to make sure that the question are separate in the school. So
yeah,
that's why you should ask the question separately, because your
yeah.
patient he may forget to
The
answer
last,
one of them.
the last 2 points. I think you forget to ask about the family history.
Yes.
Here is important because this patient have maybe thyroid cancer. Okay, and you ask about smoking and alcohol together. Regarding discussion, you manage your discussion in a very nice way. I'm so glad that you mentioned MDT, full clinical examination, and you answered all questions correctly. Very nice, Ala.
So
Ali, start, please.
yes, yeah. So I would say that's also a buzz for this station. There's a huge improvement from the previous one. You became more calmer. You are not in the rush, but you
Yes.
still need to slow down more. You still ask your question quickly, so you need to slow down more, Ala. There's improvement from the previous one. As Muhammad said, this is very important. Hello, my name is Ala. I'm one of the surgical doctor. You can mention your name, and you should mention your name. There's a simple grammatical mistake which I told you about before, but I think because you used it multiple times, it's became like connected to your tongue. You should say it's not there is, it's if there any.
Okay.
Yeah, you have to train yourself to write to if there any pain, if there any weight loss, if there any. You asked about the swelling hotness, which is not relevant here. You asking about do you feel hot most of the time, even in the cold weather? Because you want to ask if he has heat intolerance, right? So the
Yes.
hotness of the swelling by itself is not that important. All right.
All right.
Did you thank your patient at the end?
No, I forget.
Yes, just thank your patient at the end, and you thank him when he gave you the personal question. You say thank you, which is a very good point. Thank you, Mr. John, for sharing this information. But you should also, before you turn to your consultant, thank you, Mr. John, and then you turn to your consultant. As you can see, I don't have much of the point. This most of my points. I'm impressed, to be honest. I feel happy. All the presentation today is very good, even for the patient wise and the doctor. I just forgot for Fath Rahman earlier. I think, do you have weight of loss? No, not for Fath Rahman, for Ahmed. Ahmed, you said, do you have weight of loss? That's incorrect. You should say, do you have any weight loss? My weight of loss.
Yes, I said that, then I found I cannot correct it.
Yes.
Is,
yes. So, do you have any weight loss? Instead of do you have weight of loss? We finish for today. Tomorrow, I'm just gonna put the session time in the group in a second. We're gonna start earlier. I think most of the people are asking to start earlier than 10. So
no problem. 10 is good.
yeah, but if we make it a bit earlier for everyone, I think that would be better. We're gonna start with Hassan Asim tomorrow. He's gonna be the first one. It's gonna be acute pancreatitis. All right.
Yes.
Okay.
I have a question.
Ali,
Yeah.
continue.
في اليورين ريتنشن في البروست.
Look, لا. We're giving you a course in English and in MRCS. You speak in English to train yourself, yes.
Okay. In section and taking history and urine retention, you mentioned the causes the cause increase a specific antigen. S indicate sexual activity. What do you mean by sexual activity? Should I just mention sexual activity? Is that enough?
Yes, bisexual activity is intercourse
Ejaculation,
or
yes.
Any sexual activity can increase the BSA, yes.
Oh, okay. Okay, thank you.
Yes, you can mention it. You can mention sexual activity, especially after ejaculation. You can say that.
Oh, okay.
All right. Okay.
Ali,
yes,
I have,
Muhammad.
let me stop recording.
Muhammad, start recording. Okay. So your question is how to
interpret it.
Okay. Especially for this station, right? So, okay, I'm going to give you a trick. All right? Do you see this paper?
Yes.
So whenever you have a station, as ECG, you need to read the pulse, the rate, and everything. There's specific way to read the pulse. So you are concerned about is there any B wave or no?
Yes.
How much is the pulse? Okay. And to count the pulse, you look between the big two QRS. How many big square between them? And you divide 300 by the biggest squares. That will give you the number of the pulse rate. If that was regular, if it was irregular, you need to count 20 big square, and in this 20 big square, you count how many QRS between them, and you multiply by 10.
Yes.
That's how you count the pulse. Then you need to check for ST elevation, ST depression. That's the most important.
Yes.
ST elevation, ST depression, because you want to exclude MRI. Non-ST elevation myocardial infarction or ST elevation myocardial infarction. That's what are you concerned about. Angina, stable angina has no ECG changes and no high troponin.
Yes.
Okay. Regarding specifically this ECG you're asking about, so look, you look at lead 1, lead 2, and lead 3. All right?
Yeah.
Forget lead 2. Just look to lead 1 and lead 3. There's 2 QRS. When you see the QRS, the first the normal one, the normal one for the QRS number 1 and for QRS number 3 should be this way. Do you see? Both of them is up.
Yes.
Okay. There's 2 abnormalities. Both of them facing each other like this. Do you see them?
Yes.
So we call this reach each other. They are reaching to each other. Whenever you find it this way, that means right axis deviation. And whenever you see lead 1 doing this up, and lead 3 doing this down, they are leaving each other. They are leaving each other. Leaving left axis deviation.
Okay.
So in this, they just want to make sure that you know what is right axis deviation and what is left axis deviation. Right axis deviation means that the right atrium and right ventricle are struggling due to pulmonary embolism or due whatever. Left axis deviation, that means the left ventricle is struggling, probably due to aortic stenosis or whatever. Okay?